Hi guys, welcome back. We're gonna now talk about how do you know the lung is matured or not. As we know, after 34 weeks we are good enough. Pediatrics is by 35. Pediatrics says 35 is 100% mature. Gynecology and obstetrics says 34, right? So just switch around this value only. So how do you know that the lung has been matured or not? Very easy technique that we can use is LS ratio. Right? If it is more than 2.1, that means we know that lung is matured. Okay, now very important is that we want to take the amniotic fluid. Okay, now this amniotic fluid is going to have okay, this is going to have this one, right? But please remember, we also have choline. Remember, in the surfactant we are having phosphatidylcholine and we are having this as well. Remember, 70% of surfactant is made up of this, right? But if we check for this value, we will get a wrong value. Why? Because this is being start to produce from around 24 week of gestation only, and we want to hit target of 34, right? So we want to switch to this. This is the best parameter, right? If you see this, that this is present, very sure that we are sure that the lung has been matured, right? And another thing that you have to remember is this one. It is also seen in amniotic fluid. Okay, it is also seen in fetal serum, maternal serum. So you can't appreciate from where it is coming, and also it is being start to produce from 24 week of gestation, which is not going to suffice our main objective, right? All right, so we are going to look out for this one. This is only coming from only seen in amniotic fluid. Right, this is only going to present. If this is there, for sure the lung is mature. So you can say final indicator of lung maturity. That's all. This is very important. Okay, but again you have to remember 70% of surfactant is made out of this, but this is not going to be effective for us. Now how can you know that the lung has been matured? Okay, so we can take the shake test. Okay, what we're going to do is this. We'll take a test tube. Okay, we're going to take a test tube, fill it up with amniotic sac, and then amniotic fluid, and here we're going to add saponification agent. Okay, and if we will shake it, now if we shake it and bubbles are formed, that is soap. If we add saponification agent with fat, we have soap, right? So if this is having fat, so it means we are having lung has been matured. Remember, this fat is actually seen from the shedding of skins. Okay, but what it gives an indirect evidence that the lung has been matured. If there is enough amount of fat in the skin that is shredding out, that means there is enough amount of fat inside the lung. We cannot go and take out the fat inside the lung. We are trying to see an indirect method. So if we see shake test is positive, this means there's enough fat in the skin that has been shredding out. That means there's enough amount of surfactant, that is also a fat, is been produced. Okay, so this shake test is a indirect indicator of lung maturity, right? We have also one more thing. We have Nile blue sulfate test. Again, what we're gonna do here is this. We're gonna take the test tube again. We are going to put this amniotic fluid. You're going to take the amniotic fluid and we are going to spin it, centrifuge it. Right now, once this centrifugation is done, what we're going to do here is this. We're going to add the coloring agent. Okay, now if more than 50% are colored orange, we say it is the lung is matured. Okay, remember This is also seen for the lung maturity, right? 50% if it turns orange, okay, 50% of the cells turns orange, that means it is mature. And shake turns if you have enough fat in the amniotic fluid, that means also lung has been mature, okay. And these are the main two things here. This means if I say in another word, lipid of skin, if it is positive, this means also there is positive lipid in lung. This also means that, okay. Now please don't confuse this test with nitrogen paper test. What is this nitrogen paper test? This test, if there is PROM, okay, if this rupture of membrane, and the rupture of membrane can take, let's say if it is taking here, this is high rupture. So if the fluid is coming here, it cannot come out very easily. It will just come out slowly, trickling, because there's pressure here, right? There's pressure. It's been, the cervix has been kind of relatively closed here. And if you have low rupture, like it will come out suddenly a gush of fluid. Then the mother will come. I was sleeping in bed, and suddenly a gush of water came out without pain. So it is very easy to diagnose. But if it is high, it will slowly come, right? So in that test, remember, if you are having vaginitis means inflammation. This means acid, right? If you put acid and you put the litmus paper, right? If you put, it's the kind of litmus paper, it will turn red in color if it is vaginitis. But if it is amniotic fluid, okay, it is alkaline. Okay, it is alkaline in nature. So I remember A to A. Or vaginitis means inflammation. There is like dangerous things going on. So there is acid. Okay, so if it is amniotic fluid, it is alkaline in nature, so it will turn into blue, right? So this was a small video about how to know the lung has been matured, assessment of lung maturity. And please do not confuse with this. Nitrogen paper test is not for lung maturity. It's to know that if the fluid that is coming out in PROM, okay, if there's a rupture of the membrane, we want to know it is due to vaginitis. And vaginitis also will be having some amount of discharge coming out, right? Some amount of fluid like coming out, maybe pus or something might come out. In order to differentiate, that will be also like watery in color, maybe mixed with pus, maybe, but that will be also trickling, like fluid will come out. So in order to differentiate, is it amniotic fluid, the rupture membrane is ruptured, or the it is vaginitis, we use the nitrogen paper test. If it is amniotic fluid, it is alkaline, it is blue, it turned blue. Vaginitis is acidic, so it will turn red. Okay, so these are the tests that you can know that the lung has been matured. I'll see you in the next video. Thanks.